Alright. What's up, guys? What's going on here? It's Nick. Something I just wanted to talk about real quick was, common distortion patterns. And there's one pattern that I want to talk about real quick was pronation distortion pattern. And what's a pronation distortion pattern? It's a syndrome of postural distortion syndrome characterized by a foot pronation, flat feet, and abducted internally rotated knees. So basically, long story short, what that means is your feet cave inward, they're like unbalanced, and your knees are also caved inward. So this is more towards like the heavier population, but this can also happen with other people too. Like your knees cave inward and your feet also move inward, which basically, long story short, no bueno. It's no good for you. So how can this affect your daily living? Well, some altered joint mechanics, something that could harm your everyday life, is the knee abduction, which is the knees caving inward. Foot pronation, which is your feet moving inward, right? Foot external rotation, you're walking like a duck. Ankle dorsiflexion and ankle inversion. So how can this compare to everyday life? For a woman, number one, dorsiflexion. Dorsiflexion is simply pointing your feet down, right? So if you're wearing heels and if you can't point your feet down, it's going to be very uncomfortable and it's going to be very hard to put your feet in that heel depending upon what size heel you're wearing. I guarantee you that you're going to have this thing called plantar fasciitis or lower back pain, because all that pressure is going down. It's called the kinetic chain. It's going to go through your heels, then your knees, then your hip, then your lower back, and then it doesn't feel good. So that's one thing how this can help women. And for men, you just have the pressure of the knees. I mean, who here is in the range between 25 and 55? Because this is usually in the ages between where it happens, 25 and 35 actually. And whose knees hurt? I mean, especially for the older population, whose knees hurt, and who wants to fix that, right? So how can this help you? There's called short muscles and there's called lengthened muscles, right? The short muscles called the gastrocnemius, soleus, peroneals, abductors, IT head, the hip flexors, the bicep femoris. Those are short muscles. Basically, long story short, what you need to do with those short muscles, and I don't want to make a project out of this video, and I don't want you to wait 10 minutes. I just want you to do your own due diligence and research and see what I'm saying is accurate. But if your muscles feel tight, or if you have that knee problem where your knees, and let me just show you an example of that real quick. If your knees move inward like this when you're standing up, and you just notice a little bit, they move inward when you're standing, and then your feet are internally they're on the inner sides, like they're on the inner sides. And that's another thing with women, when they're walking in heels, you don't want to be walking on the side of the foot. You want to walk on the balls of the feet with those heels, like not on the sides of the feet. It's not good. But yeah, your knees will usually be pronating. Just getting back to where I was, you need to foam roll it out. It's called SMR, self-myofascial release. I got this on Amazon for $30. It's really awesome. It costs $30. It's a tube, which means it's really strong. It also has these things on it which really get in the muscles. And why does it work? And for those of you saying why, it's called autogenic inhibition. What that simply is knots in your muscles from everyday inactivity. So every time that you walk with your knees internally rotated, every time that your feet are pronating, and I'm not diagnosing you, and you should consult a physician if your knees really hurt, but free advice from me that's pretty accurate from NASM is when your knees adductively move inward and your feet pronate, which means that you're walking on the sides of your feet, which aren't good in itself. What that usually could be is a muscle. So what you need to do is you need to foam roll it out for that autogenic inhibition to take place, which basically means you hold a spot of discomfort for 30 seconds or more, and then you simply stretch it out, right? But another problem that could be is for people who simply don't work out, and there's And there's these things called anterior tibias, excuse me if I say the word, posterior tibias, vastus medialis. Then we have the glutes, which is the butt, and the medius, which is the side of the butt, and then the hip external rotators, right? But I'm not going to get into that because, once again, the video would be too long. So, for short muscles, right, what you would want to do is simply, I'm just going to put this down real quick, say, for example, the gastrocnemius, right? That's the calf muscle. So what I would do with this foam roller right here is I'd put my leg on the foam roller and I'd simply look it up on Google. I'd see where the muscle precisely is, and I'd hold it there and I'd twist and I'd turn and I'd see if there's any knots. I don't have any knots because I've actually been rolling it out a lot more lately, so I feel really good. But say if I had a knot like right here, I'm going to hold that there for 30 seconds. And once I feel this excruciating pain for like 30 seconds, and if you don't feel the pain, it's fine. You should just feel some discomfort. For those of you who are pain resilient, you feel some slight discomfort and you hold it there for 30 seconds and stretch it out by doing a simple calf stretch. That's going to help that knee from caving in, because it's called the kinetic chain of motion. And what that basically is, every time you take a footstep, that energy travels to the feet, which come up to the knees, which goes up to the hip, to the back, and then everything else. The hip, the back, the spine, and the shoulders, then the head, which causes those imbalances in your body, which basically hurt you every single day. So pronation, distortion, are knees caving in, you're walking on the sides of your feet. Try this. I hope this helped you. I appreciate you for watching this. Remember, overview, if you have short muscles, and basically if your muscles are tight, SMR, self-myofascial release, and stretch. For those of you who don't work out a lot, you gotta work out. Simple as that. And then look up ways to strengthen, something really good for muscle imbalances or core exercises, which are really crucial. I mean, if you want to, how bad do you want to get rid of that back pain? How bad do you want to get rid of that knee pain? All right? But guys, thank you so much for coming on. I really appreciate it. If you guys need any help, tips, advice, questions, answers, or anything, or if you want to correct me on the tibias, if I even said that right, just feel free to comment, like, share, whatever. And thanks so much for listening. I really appreciate it. I hope you all have a nice day.